Congratulations, you're done with your hair transplant. We're excited to see the journey you're about to embark on as your hair grows in over the coming months, but first we have to get through the first 7 to 10 days post-op, and that's what we are going to discuss here in this video today. If this is your first time watching this video, I suggest you watch it all the way through so you don't miss anything, and then you can use the chapter markers to review anything you might need later. With that said, let's get right into it. When you leave the office at the end of your procedure, you will be escorted down to your ride home. You will need to have someone drive you home, as we likely gave you some sedatives to help you sleep during your procedure, as well as some pain medications. These medications make it unsafe for you to drive, so someone will need to drive you home to make sure you get home safely. When you get into the car, please be careful that you don't bump your head on the door sill and dislodge your newly placed grafts. It's easy to do, especially when your head is still numb from the procedure. When you get home, you can remove the blue hat that I placed on your head before you left by grabbing it with 2 fingers and lifting straight up very slowly. I then want you to start spraying your scalp with a little spray bottle that I gave you in your post-op care bag. This bottle has a solution that is physiologically similar to the fluid in your body and will help keep your grafts hydrated over the next few days while the blood supply comes in. Make sure you do about 4 to 5 sprays over the areas where the grafts were placed about every 30 minutes to an hour while you're awake. Your bottle should last about 3 to 4 days, but if you run out, you can refill the bottle with drinking water and begin spraying again until you get through the first 3 to 4 days. Another thing to do when you get home is to take your pain medication and your antibiotics if I didn't already give it to you before you left the office. I typically give all of my patients one last pain medication and their antibiotic before they leave at the end of the day, so they don't have to worry about it when they get home. However, there are occasions where this might not happen, so if we didn't give it to you before you left, please make sure to take it when you get home. I want you to take your pain medications on schedule for the next 2 days, even if you feel like you don't need it. It's very possible to have the pain sneak up on you and then you're left trying to get your pain back under control again. As for your antibiotics, please take these to completion to keep our risk of any post-op infections as low as possible. Before you climb into bed, you're going to need to get your bed ready, and hopefully you will have done that prior to your procedure today. But if you haven't, here's what you'll need to do. You'll be sleeping on your back for the next 7 to 10 days after your surgery, as your grafts cannot make contact with the bed, otherwise they're at risk of being dislodged and falling out. So you'll need to arrange a bunch of pillows along your sides to help keep you on your back, or you can even sleep in a recliner if you have one of those. You will also need a couple of pillows up under your head to keep your head elevated about 30 to 45 degrees, as this will help with the swelling that is going to occur in your scalp and to an extent in your face after the surgery. Elevating your head will help all of that drain much faster than lying flat. Once you have your pillows for your head, you will need to lay down a towel over your pillows and then cover the towel with a blue and white drape with the white side facing up. This will help absorb any of the drainage you will have over the coming days and prevent it from soiling your sheets. Use a new pad every night until no further drainage is seen on it in the morning. If we have placed grafts in your crown area, you will need to drape the blue and white absorbent pad around a travel pillow and then slide that around your neck with the open part of the pillow facing forward. This will help prevent your crown region from making contact with your pillow and help preserve your grafts. If you have a non-stick dressing taped to the back of your scalp when you get home, I want you to leave those on unless I discussed with you otherwise in the office before you left. You will also leave these on as you lay down to go to sleep. Make sure the tape that is on your forehead stays on for the next 5 days to help minimize the swelling in your face. The morning after your hair transplant, you may take a shower, but do not let the jets hit above your neck. The spray from the jets is too powerful at this time and will knock your grafts loose and they will go down the drain. But what you can do is take a cup of water and you can mix it with some gentle shampoo such as baby shampoo. Stir it with your finger to get some suds built up in there, and then go ahead and pour it over your head, letting it run forward over the newly transplanted grafts. Let it sit for about 30 seconds and then take a cup of clean water and pour it up over your head again. Make sure not to touch or rub the new grafts when showering. Also make sure to spend less than 5 minutes in the shower with lukewarm water running. Prolonged exposure to hot water can cause the grafts to swell and then pop out of their sites, so you're then again at risk for losing your grafts. Once you get done with your shower, allow your scalp to air dry, as drying it with a towel will also dislodge your grafts. Repeat this process until day 10 after your hair transplant, and after day 10 you can wash your hair like normal. When you get out of the shower, for the first 5 days after your hair transplant, I want you to apply bacitracin on each side of the back of your scalp, working from the center of the back of your head to the sides above your ears. So you're going to crack open one of the white packets that I gave you, and you're going to rub it across the back of the scalp here, all the way across up to the ears, wherever there's little polka dots. Crack open the second packet and rub it all the way across here. Next, open the rectangular Telfa dressings and apply one on each side of the back of the head. These are non-stick dressings and will be easy to take on and off every 24 hours. After the dressings are applied to your scalp, you can then tape them to your scalp with the paper tape that was included. Make sure to keep the tape down low around the top of the ear and then it doesn't come in contact with any of the newly transplanted grafts. If you had a strip procedure, you can cover your incision with the non-stick dressings and then use some rolled gauze or a headband to secure the dressings, but be very careful not to let the headband or rolled gauze come into contact with the recipient area. When you get to day number 5 after your hair transplant, you can then remove the tape that's on your forehead. Hopefully this has helped to minimize the amount of swelling you have in your face. Sometimes it's effective, other times it may not help all that much, but at least it's something. Other things to keep in mind for the first 10 days after your hair transplant are to avoid any heavy lifting or strenuous activity. These activities, along with even simply bending over to pick things up off the floor, will increase the pressure in your scalp and could potentially dislodge your grafts. You will also need to refrain from any sexual activity because, yep, you guessed it, it increases blood pressure as well. You'll also need to refrain from wearing hats for about 7 days at minimum so that the hat does not rub on your newly placed grafts. I typically prefer 10 days with no hats, but 7 days would be the minimum amount of days that I would recommend. An important thing to remember is no touching of your newly placed grafts for about 10 days. I can't stress this enough, these grafts are delicate and in the first few days it doesn't take much to dislodge them. You're also going to want to refrain from any alcohol use for about 10 days post-op, as alcohol tends to thin out your blood and could increase your risk of bleeding after the procedure. Then we come to the absolutely most important part of this procedure. Definitely don't start smoking after your hair transplant. That includes vaping and smoking of any other substances as well, as this will decrease your oxygen levels and possibly minimize blood flow to your new grafts that need all of these things to survive. If you plan on resuming smoking after your procedure, I recommend not doing that. But if you are going to do it, I ask that you wait 6 weeks until after your procedure to start smoking again, as this will give your grafts the best chance to survive. I would even advise against nicotine patches, as this can also limit blood flow to your grafts as well. Once you've made it to day 11 after your hair transplant, you can resume all normal activities, including going back to the gym. You can also resume sleeping normally as well. So that's it. You will breeze through the recovery process pretty quickly by following these instructions and set yourself up for great results in the long run. Thank you for choosing us for your hair transplant, and we look forward to seeing your results over the coming months. If you have any questions or concerns about your post-op care, please call the office at 512-764-9076 if you need to speak to someone right away, or text the office with questions that are not urgent. We'll get back to you as soon as we can. I'm Dr. Paul Pearce, and we'll see you soon.